Hello everyone, welcome back to channel for doctors, and today we are going to study about the actions of the hip muscles. We have completed our session on the anatomy of the upper limb, and now we have moved on to the anatomy of the lower limb. So starting with the action of the hip muscles, we need to remember that there are 6 different groups of muscles that are present in the hip region. These involve the abductors, the adductors, the extensors, the flexors, the internal rotators, and the external rotators. So starting with the abductors, these are the group of muscles that are basically involved in moving the body away from the central line. For example, if these are the hip muscles, then we have the thighs region. All right, so all those muscles that move this body up and this limb, for example, this is the left limb and this is the right limb. So all those muscles that are involved in moving this away from the central line, these are known as the abductors. The abductors include the gluteus medius and the gluteus minimus that are present on the earth butt region. Okay. Then we have the adductors. The adductors are a group of muscles that are involved in moving and in performing basically the opposite tasks, and then the abductors, and that is moving the tissues towards the central line. For example, if this is the muscle group and the thigh is extended there, and sorry, it is abducted there, and this is the central. So these muscles and the adductors will be involved in moving this limb towards the central line and positioning it this way. So this will be the group of muscles that are known as the adductor magnus, the adductor longus, and the adductor brevis. So basically, these 3 group of muscles are known as the adductors: adductor magnus, longus, and brevis. Then you have the extensor. So extension in the leg involves basically making the leg upright. All right, this is the knee joint, and then this is the lower limb, and this is the thigh region. So this position is known as the extension. Now if we move the lower limb, and here is the foot, and if we move the lower limb towards the upper side, that is, and this is the thigh, this is the knee region, and this is our lower limb. All right, so if this is the case scenario, then this is known as the flexion and this is known as the extension. So the extensor muscles result in the extension of the lower limb, that is stretching out the leg, and the flexors result in flexion of the lower limb, that is bending of lower limb at the knee joint. So the group of extensors are basically gluteus maximus, semicutaneous, and semimembranous, whereas the group of flexors are basically the iliopsoas muscle, the rectus femoris muscle, the tensor fascial lata, and the pectineus and the sartorius muscles. So these flexors are present on the back of the thigh, and here is the knee joint, and this is the group of muscles represented here, including iliopsoas, rectus femoris, tensor fascial lata, pectineus, and sartorius. So these are the flexors and the extensors. Then we have the internal rotators. So the internal rotation is basically inward turning of the leg. For example, if you have a straightened out leg, and if you are moving it the inward, this is known as the internal rotation. And if you are rotating leg like this, so this will result in the external rotation. All that, the internal rotators of the hip joint include gluteus medius, gluteus minimus, and tensor fascia lata, whereas the external rotators include the iliopsoas muscle, the gluteus maximus, piriformis, and occipitator muscles. So this was all about the action of hip muscles. You are usually tested on these functions on the USMLE step 1, so you need to be well aware of these actions of hip muscles. So a brief quick revision: abductors are those muscles that move the body part away from the central line, include gluteus medius, gluteus minimus. Adductors move the body organs towards the central line, include adductor magnus, adductor longus, adductor brevis. The extensors straightens out the leg, such as gluteus maximus, semicutaneous, semimembranous flexors result in a movement at the knee joint and the hip joint, and these muscles include iliopsoas, rectus femoris, tensor fascial lata, pectineus, and sartorius. Internal rotators result in internal rotation of the limb, include gluteus medius, gluteus minimus, tensor fascial lata, and external rotators result in external rotation of the limb, including iliopsoas, gluteus maximus, and piriformis, and occipitator. So this was all about the action of the hip muscles, and in the next video we are also going to continue on anatomy of the lower limb. So keep watching our channel, and if you have any questions you can ask in the comment section. Thank you.